Riya, welcome to Narikaa Talkshow. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome our very acclaimed doctor, Dr. Bela, who is present here with us, and she will be answering some of our questions regarding today's topic, which is First-Trimester Maternal Screening Test. So doctor, before jumping to the questions directly, please tell our viewers something about yourself.
So, thank you, Riya. So, this is Dr. Bela. I'm an obstetrician and gynecologist and a fetal medicine consultant at Rainbow Women's Hospital, Mumbai, as well as a fetal medicine consultant at Babasaheb Ambedkar Central Railway Hospital, Mumbai. So, basically, I'm an MBBS, MD, ONG.
Doctor, which moment would you say was the moment when you decided to become a doctor?
So it's been a long journey, in fact. So when I was in my schooling days only, I decided to become a doctor. And when I was doing MBBS, when I had my gynec term, that is the time when I saw that there is a lot of need to help our women of our country. And that's when I decided that I am going to take up OBGYN, that is obstetrician and gynecologist, as a branch or as a specialty to do my post-graduation.
Doctor, as the topic itself says, first trimester screening test. So doctor, our first question for our viewers is, what is first trimester screening test?
So first trimester screening test is a very, very important test, which is a combination of ultrasonography and maternal blood test. Right? In ultrasound we have nuchal scan, and in blood test we have double marker, that is beta HCG and PAPE. So basically we combine both and calculate the risk for some of the common chromosomal problems, and that is what is known as combined test or first trimester screening test.
And doctor, why is first trimester screening test is done?
So as I said, this is a screening test for some of the common chromosomal problems. First thing we need to remember is it's an indirect test. It is not a diagnostic test. It's a screening test or indirect test in which we are trying to give possibilities of some of the common chromosomal problems like trisomy 21 or Down syndrome, trisomy 18 and trisomy 13. These are the three most common chromosomal problems in the baby for which we try and calculate risk through these tests.
And doctor, what is being tested in first trimester screening test?
So that's what. Basically, the first trimester screening test tells us a lot of, gives us a lot of information about the baby or the fetus inside. So in that, we can find out almost 50% of major structural problems. That is one thing through the ultrasonography or nuchal scan, and through some of the soft markers, we try and calculate the risk for Down syndrome or trisomy 21, trisomy 18 and trisomy 13. So that is ultrasonography. And in the blood test that we do, beta HCG and PAPE, the lab will again give us a risk for the same, and then we combine both and then explain to the patient as to what is the possibility of this, whether the patient, the baby inside is at higher risk or lower risk for these problems.
And doctor, what can a woman expect during her first trimester screening test?
Yeah. So she needs to understand that the sonologist or a fetal medicine expert is going to do ultrasonography, that is nuchal scan, which usually takes around 30 minutes time, and there is a blood test, a laboratory test, the result of which will be available in 48 to 72 hours. And at the end of that, as I said, based on the number that we get, so the result would typically tell us that the possibility of trisomy 21 or Down syndrome is 1 in 1000, 5000, 10,000. So based on that, we try and find out whether the possibility, the risk is high or low, and then we counsel the patient whether she is falling in high risk or low risk category.
Doctor, what first trimester screening test tell about the woman in pregnancy?
So gives us three important information. One is about structural problems. 50% of structural problems we can rule out right at 3 months of pregnancy. Second thing is about chromosomal problems, as I said. And third important aspect of this first trimester screening is we are able to predict some of the complications which are going to come up in the later months of pregnancy, like high blood pressure because of the pregnancy, or lesser growth of the baby during 6th, 7th, 8th month, which we can predict right at 3 months and start some of the preventive treatment also. So that's the advantage.
How is this test performed?
So the ultrasonography is performed by a trained sonologist for nuchal scale, who will be looking at not just the structure of the baby but some 4 common soft markers, which is one is nuchal translucency, which is the fluid behind the neck of the baby, then nasal bone ossification, and then 2 more markers are ductus venosus and tricuspid fluid. So based on these 4 markers, we try and calculate the risk for trisomies. That is ultrasound. And as I said, the blood test, we send the blood to the lab, and then the lab will be giving the report.
And doctor, exactly when this test is performed?
So that's a very good question, because patients need to remember that this test has to be carried out between 11 to 13 weeks, 6 days. So we look at the length of the baby in that, which has to be between 45 millimeters to 84 millimeters. So if the patient, this test is done before 11 weeks or after 13 weeks, 6 days, it is of no use, because it does not give us the risk calculation. So very important for patient to remember that it is done at 3 months or 11 to 13 weeks, 6 days. That is the time.
And doctor, how accurate is this first trimester screening test?
Again, a very important question, because many a times patients feel that this will 100% tell me whether the baby is having Down syndrome or trisomy 21, 18 or 13. No. Remember that this is a screening test or indirect test. So the sensitivity of this combined test, combination of nuchal scan and double marker, is to the tune of 85 to 90%. So when we claim that almost 8 to 9 out of 10 Down syndrome will be able to pick up, we may miss 1 or 2 out of 10. And that is what patient needs to remember, because this is not a diagnostic test, this is a screening test.
And doctor, women still have the second trimester screening test?
Yes, again very important question. See, the thing is, we always look at the sensitivity of test when we offer any test. Now, for chromosomal problems, the most sensitive screening test is first trimester screening, that is combination of nuchal scan plus double marker with a sensitivity of 90%. The second trimester screening test, which is a quadruple marker, has sensitivity of only 80%. So if a first trimester screening has already been done, then no, second trimester screening should not be offered. But suppose the patient missed the first trimester screening, patient comes to the doctor only after 15 weeks of pregnancy, then yes, what we can offer is second trimester screening, and that is quadruple marker.
And doctor, what are the risks and side effects to the mother or the baby?
Again, excellent point, because the patients may have misconception that there are some side effects of ultrasonography of the test, but the ultrasonography is extremely safe both for the mother as well as baby, and blood test is like any other blood test. So neither of the tests, neither the sonography nor the blood test has any side effect on mother or baby.
And doctor, what is a Down syndrome?
So Down syndrome is trisomy 21. So we must understand that each one of us has 23 pairs of chromosomes in a cell, out of which on chromosome number 21, when there is, instead of 2 chromosomes, if there are 3 chromosomes, that is what is known as trisomy 21. This is scientific information. What can it lead to? So it can lead to mental retardation in the baby and some of the structural defects like heart defects or defects of the brain, some of the gastrointestinal defects. So these kind of various defects can be seen in Down syndrome baby. But again, sometimes say 30 to 40% Down syndrome babies may not have any structural problems. And that's the reason we need this screening test, because it may not show up only on sonography, and therefore we need to have this combined test to screen patients for the risk calculation.
And doctor, what is Edwards syndrome?
That is trisomy 18, in which instead of 2 chromosomes on chromosome number 18, there are 3 chromosomes on chromosome number 18. Again, what can it lead to? It will lead to mental retardation and various structural defects in the baby.
Alright, so it's time for a short break now. We will all see you in next few minutes. Welcome back to Narikaa Talkshow once again. Moving on to our next question. And doctor, are there any other invasive screening tests involved?
Yes. So the entire purpose of doing screening test is to segregate high risk population from low risk population. Now what do we do with this high risk population? Suppose the risk comes as more than 1 in 250. That is when we call it high risk. And these are the patients to whom we offer diagnostic test or invasive test, which includes chorion villus sampling or amniocentesis.
And doctor, what happens after the first trimester screening test?
So, as I just mentioned, after the first trimester screening test or a combined test, we segregate the population into high risk and low risk category. High risk is when the report comes as more than 1 in 250, that is maybe 1 in 200, 1 in 150, that is called high risk. So, these patients we counsel and explain that there is a need for diagnostic test like chorion villus sampling at 3 months or amniocentesis at 4 months onwards, because that is a diagnostic or a definitive test which will tell us that whether this particular baby is affected by trisomy 21, 18 or 13 or not. So that is what we offer to the patients who are into the high risk category. Those patients who fall in the low risk category, to them again there are 2 zones, there is one intermediate risk and there is one low risk. So when the risk is more than 1 in 1000, that is known as low risk, and in that we do not offer any other further screening because we have done the best of the screening test. So these are the patients whom we call at 4.5 to 5 months for structural anomaly scan or a detailed anomaly scan. Whereas those who are in the intermediate zone between 1 in 250 to 1 in 1000, these are the patients in whom we offer secondary screening test or a better screening test like NIPT.
And doctor, what is maternal serum screening test?
So when we take separately maternal serum screening test, there are first trimester and second trimester serum screening test. The first trimester screening test is dual marker, which includes beta HCG and PAPE. We look at the MOM of that and we try and calculate the risk for trisomy 21, 18 and 13. Whereas second trimester screening test is a quadruple marker which includes 4 hormones in that. That is beta HCG, there is inhibin A, there is alpha fetoprotein and serum estrogen. So the combination of these 4 is known as quadruple marker and the sensitivity of it is around 80 to 85%.
And doctor, why is this test performed?
So again, the aim of all these serum screening tests or combined tests is to try and find out the possibility of common chromosomal problems, and this is an indirect test.
Does the patient gets the result of the FTS?
Okay, so the first MS or FTS, the result is obtained within 48 to 72 hours, because ultrasound will give the result on the same day, but the blood test goes to the genetic lab where beta-hydrogen peptide is the risk calculation based on that is calculated, and then we combine it with the ultrasound result. So it takes almost 48 to 72 hours.
And what is the difference between the maternal serum screening test and NIPT?
Okay. So NIPT, the full form is non-invasive prenatal testing or non-invasive prenatal screening test, better called as NIPS because it is still a screening test. Now what happens in NIPS is we try and find out the same chromosomal problem from the baby's DNA which are circulating in mother's blood. So we take mother's blood. From that, there are mother's DNA as well as baby's DNA fragments which are circulating in maternal blood. So we try and find out whether these fetal DNA or baby's DNA are having any kind of chromosomal problems. Again, the most common chromosomal problem that we look at in NIPS is trisomy 21 or Down syndrome. So NIPS is the most sensitive screening test for trisomy 21 or Down syndrome, because when we look at the sensitivity of combined test is 90%, whereas that of NIPS or NIPT is 99% for Down syndrome. So that's the most sensitive screening test for Down syndrome.
Doctor. And doctor, what does screen negative in maternal serum screening test does mean?
So see, typically a lab would give you a result of screen positive or screen negative. So as I said, if the risk of a particular chromosomal problem like trisomy 21 or 18 or 13 comes as more than 1 in 250, the lab would give, or the combined test would give screen positive. Whereas if it is more than 1 in 1000, the risk is less than 1 in 1000, then it is low risk or screen negative. But it's very important for the obstetrician to understand that screen negative does not mean that there is no possibility of this particular chromosomes in the baby, because these are still screening tests and not diagnostic tests. So better to explain by the number which is written in the test rather than screen positive and screen negative. If it is 1 in 1200, we have to explain that this shows that with all such reports, there is one baby out of 1200 may have this particular disorder. That's how we explain to the patients.
What if the screening shows the increased risk for the conditions?
So that is what is known as high risk for that particular condition, that is high risk for trisomy 21 or 18 or 13. That's when we offer them diagnostic test or chorion villus sampling and amniocentesis, either of it.
And doctor, what is CVS?
CVS is chorion villus sampling, which is a diagnostic test which is offered to patients when there is high risk for any of the chromosomal problems based on screening test. Now in this is typically done around 3rd month of pregnancy or between 11 to 13 weeks 6 days when we do nuchal scan. So if following this screening test, if the patient has high risk, then what we do is with the help of needle, a small bit of placental tissue or the chorionic tissue is taken out, which is sonography guided, and that particular tissue of the placenta which represents the baby inside is sent to the genetic lab for definitive diagnosis for that particular chromosomal problem, that may be trisomy 21 or 18 or 13.
And doctor, what is amniocentesis?
So sometimes it happens so that the test is carried out in the 2nd trimester, or maybe the 1st trimester screening shows high risk, but the patient takes time to decide whether they want to go for a diagnostic test or not. In that case, if it is 16 weeks plus, then we offer them the diagnostic test which is known as amniocentesis. Now the difference between chorion villus sampling and amniocentesis is that in amniocentesis, we put in a needle inside the uterus and we take out the fluid which is surrounding the baby, and that is known as amniocentesis. And again, that fluid is sent to the genetic lab for definitive diagnosis of a particular trisomy, that is trisomy 21, 18, 13, etc.
And doctor, can NIPT gives the information other than Down syndrome?
That's a very, very pertinent question, because there are many misconceptions about NIPT. People feel that one's blood, because NIPT is something which is done from mother's blood. So they feel why to go for all this ultrasound and double marker and all those tests. Instead we should do NIPT and we can get all the information. But that's a misconception, because NIPT is a test which is most sensitive for trisomy 21 or Down syndrome, that is 99.2%, and almost 96-97% for trisomy 18 and 13. But that's it. Other than that, it's not very sensitive test for other chromosomal or genetic problems. Whereas the combined test, that is nuchal scan plus double marker, gives information about many other genetic problems other than trisomy 21, 18, 13 also. So the spectrum of the chromosomal problems for which the NIPT gives information or is sensitive for is very low as compared to combined test.
Well, doctor, thank you, doctor, for sharing your informative views on it. And I hope this session was really helpful for all the viewers out there. And doctor, before leaving, is there anything else that you would like to share with our viewers?
Yes, of course. Because I am a fetal medicine consultant and I do regular ultrasonography during pregnancy, I want to give out a message about ultrasound in pregnancy. First of all, gone are the days that when patients used to go for registering at 6th, 7th, 8th month of pregnancy. As soon as you miss your period, you must go and consult an obstetrician. The first dating scan is done around 7 to 8 weeks of pregnancy. Then there are two extremely important sonography during pregnancy. One is nuchal scan, as we discussed about, which is done at 11 to 13 weeks, 6 days. And the other one is detailed structural anomaly scan, which is done at around 18 to 22 weeks. So these are the two scans which no patient during pregnancy should miss. And thereafter also there are some of the important scans like fetal echo regarding the heart of the baby. Then there is a growth with Doppler at around 28 weeks and 32 to 34 weeks, which will tell us about the growth of the baby, some of the late developing structural problems, growth disorders, everything we can pick up from those ultrasound. So I just want to tell that ultrasound is here to give us lot more information about the baby which previously we were not able to get. So make the most use of it and have a healthy pregnancy and healthy outcome.
Well, doctor, that was really a great response, and it means really a lot to us to be with you in a Narikaa Talkshow. And thanks a lot for your precious time.
Thank you. Thank you, Ria. It was indeed a pleasant experience.
Thank you, doctor. So we will all see you in next session with another interesting topic. Till then, to all the lovely viewers, stay happy, stay safe, stay tuned.